It is a beehive of activity at the Uganda Virus Research Institute main laboratory, as scientists here spend sleepless nights studying the ever-mutating HIV virus. Dr. Ssemwanga is one of the scientists here burying their heads into understanding infection, drug resistance, and molecular virology, which involves understanding where new infections emerge from.
The main focus in our research is HIV AIDS research, which is basically geared at contributing to vaccine design and development. So the basic science research that we're doing is to basically look at the various virological aspects that can be very useful to vaccine development. The other major focus of our research, we're using molecular virology techniques to understand our HIV epidemic within the context of Uganda, where we are trying to understand where new infections are emerging from within Uganda.
He clarifies that two types of resistance have been fueled by victims taking on other types of infections from different subtypes, which is termed as HIV superinfection.
There are two types of HIV drug resistance. I'll start with the acquired drug resistance. So this acquired drug resistance is basically it emerges among people who are on treatment. So for some reason or another, they develop resistance due to the treatment that they are on. On the other hand, transmitted resistance basically refers to those patients that get infected with HIV, but in this case, the virus that is transmitted is already drug resistant.
This senior scientist warns such reinfections enhance disease progression and hence weakens one's immune system.
So if, for example, you're testing for serostatus of someone, you're testing whether they're positive or not, it is here where you confirm.
Studies here have equally identified the most at-risk populations, popularly known as MAPs, as the major victims to this no longer rare condition of superinfection. These include sex workers, uniformed men, border cyclists, fisherfolk, truck drivers and the army, among others. Often, doctors have been forced to transfer patients to second line of HIV treatment after they develop resistance to first line of treatment, but not many get to know why they fall in this trap. Dr. Ssemwanga clarifies that acquiring different strains of HIV greatly alters treatment and determines how one will suppress this slow but sure virus. Resistance gives room for the HIV to quickly multiply within one's white blood cells as they make as many copies of themselves as possible, weakening immunity and, if no immediate intervention occurs, causing quicker death. I am Fatuma Nalwanga for Urban TV.